Hi, I'm Dr. Ramsey, and we have a brand new podcast that we're starting today, and it's called Everything Hormones. What I'd like to do for each podcast is start off with a short prayer. Today's is, God, I release control and trust you. Speak through me what is needed today and let it reach the people it is meant for. Amen. So, if you don't know me, my name is Dr. Theresa Ramsey. I've been in practice since 1996. Prior to that, I was an RN. Once I made the move from being an RN to a functional medicine practitioner, my whole life changed. The health of my body changed. My mind, my spirit changed dramatically. And then when I became a hormone specialist, that even changed again. So I've just been so blessed to be where I am on this career. It's fun. It's exciting for patients, especially for those patients who see other doctors for symptoms and they're told that everything is normal. That's when I say we want to consider hormones, everything hormones. I can turn any condition into a hormone patient. But for this podcast, the next episode, we're going to have my teacher. The reason I know anything at all about this subject is because of my teacher. He will join us on our next episode. I can't wait for you to meet him. And then we're going to have some patient testimonials. We'll have some physicians on, and just to give you different varieties of how we look at hormones, why we use hormones, and why I don't want to age without them. So recently I had a new book come out, and this backdrop is the flower on the book called Hormones 101, Treatments Your Doctor Wasn't Trained to Provide. And why I named it that is because, again, I wouldn't know anything I'm doing if it wasn't for my teacher, and it's all research backed. Doctors don't have the time to put into the study unless it is their specialty. And so I really wanted to dispel the myth that hormones were risky. For 30 years in practice now, I've been hearing that over and over again. And I felt it very important to write at a 6th grade level so everybody could understand why they're not risky, done properly, and why they're necessary. So that's what the book's about. And I also welcome questions. Like, I want to know what you want to know. I want to be talking to you so that your questions are being answered. You can send us the questions. It's really exciting to me, especially because I truly never thought in my lifetime that the FDA would start agreeing with me. And as we've seen, in November, they lifted the warning that estrogen increases the risk of breast cancer. It actually reduces it. So the FDA put that out. And then 1 month later, the FDA changed the standards for men because they were too restrictive to give men testosterone based on the levels the FDA wanted us to get. And so it makes it more available for men to get testosterone. It wasn't talked about, but we also know through years of research that testosterone reduces prostate cancer, just like estradiol reduces breast cancer. So there's so much exciting stuff I can't wait to share with you. Stay tuned and please send questions, and we'll see you next time. Have a great day.